There's a direct correlation between your dental health and your overall health. In fact, the National Institute of Dental and Craniofacial Research, a part of the NIH, concluded the mouth is a mirror of health and disease. Because of this, the mouth can act as an early warning system for poor health. Our mouths are filled with bacteria. This includes both harmless and harmful bacteria that cause oral infections, cavities, gum disease, and bad breath. Practicing good oral hygiene routines, including daily brushing, flossing, and oil pulling, can help to keep this harmful bacteria under control and help to prevent serious dental problems, including periodontal disease and receding gums. Receding gums are one of the most dramatic signs of gum disease. When bacteria containing plaque builds up on the gums and the teeth, it causes inflammation so severe that it can actually destroy the gum tissue. This can lead to the gums pulling away from the teeth, exposing the roots and the development of small pockets that harbour harmful bacteria. According to the Mayo Clinic, oral bacteria and inflammation play a role in diseases including endocarditis, cardiovascular disease, premature birth, rheumatoid arthritis, and head and neck cancers. Receding gums are a byproduct of periodontal or gum disease. Gum disease is an infection of the soft tissue in the bone that hold the teeth in place. As the disease progresses, the gums pull away from the teeth, creating pockets that harbour bacteria, and this leads to an infection. Then, as our immune system fights the infection, the connective tissue and the bones that hold the teeth properly begin to break down. Finally, without effective treatment, the gums, connective tissue, and the teeth are destroyed. In the early stages of gum disease, many people aren't aware there's a problem. The first sign can be very subtle, such as the occasional blood when brushing the teeth and tender spots when chewing. However, as the disease progresses and the gums start to pull away from the teeth, the following more visible and sensory sensations can appear. Bad breath that isn't remedied with brushing the teeth or mouthwash. Swollen gums and gums that are dark red in colour. Gums that bleed when eating, brushing or flossing. Teeth that are sensitive to foods and drinks that are either hot or cold. Teeth that are loose or move slightly when eating or when touched. Pain or discomfort when chewing, and teeth that appear longer than others in the mouth. While poor hygiene is most often associated with receding gums and periodontal disease, there are some risk factors that increase the probability of developing this condition. Women of all ages might notice that their gums are more sensitive when they're going through a hormonal shift. This includes young girls entering puberty, and they might have sensitive gums, as well as pregnant women or those who take birth control pills, and women who are entering stages of the menopause. Researchers believe that estrogen and progesterone play a role, and in fact, increased progesterone levels can cause gum disease. As women hit menopause, dry mouth is a common complaint, and decreased saliva is a leading cause of tooth decay and gum disease. Diabetics are more prone to infections than the general population. In fact, periodontal disease is a complication of diabetes. Research indicates that gum disease and diabetes often run in tandem. The infection might make it harder to control blood sugar, and the infection might increase the blood sugar levels. Because of this, it's vital that diabetics practice good oral hygiene to prevent infections. Individuals with HIV/AIDS are at a significantly greater risk of receding gums, as they have limited ability to fight off the infections. One of the most common signs of vitamin C deficiency is poor oral health. This includes gums that are swollen, bleeding, or inflamed. According to the Centers for Disease Control and Prevention, smoking weakens the immune system, and this makes it difficult to fight gum infections. And for smokers who already have receding gums and periodontal disease, smoking makes it difficult for the gums to heal. Tobacco in any form raises your risk. Smokers have twice the risk of gum disease than non-smokers. The longer you smoke, the greater the risk. The more you smoke, the greater the risk. Like many health conditions that we face, researchers believe some people might be genetically predisposed to gum disease. So for these individuals, prevention is the key. Prescription and over-the-counter medications can cause dry mouth. Many oral contraceptives, antidepressants, and some medications for heart disease can all cause gum disease. Teeth grinding or bruxism is one of the leading causes of receding gums and periodontal disease. Addressing this condition while pursuing effective treatments is the best avenue for relief and healing. Individuals who don't brush their teeth twice a day, floss or oil pull, have a heightened risk of oral health problems, including gum disease. However, brushing with a stiff toothbrush or brushing too hard can also cause the gums to recede and lead to further dental problems. The conventional treatment, you've deep cleaning. These cleanings go beyond the annual cleaning. They involve a process called scaling and root planing. This is where the dentist scrapes off tartar from above the gum line and below the gum line. Also, in some cases, a laser may be used. To kill the infection, the dentist might prescribe certain mouthwashes and gels to reduce the bacteria and the bacteria-filled pockets. Oral antibiotics might be prescribed to fight the infection. And flap surgery. After a deep cleaning, bone and tissue grafts may be recommended to regenerate the bone and the gum. Fortunately, for those who experience intense anxiety while visiting a dentist, there's effective natural treatments for receding gums and periodontal disease. Known for its age-fighting compounds, green tea was found by Japanese researchers to promote healthy teeth and gums. A study published in the Journal of Periodontology found drinking a cup of green tea each day decreased periodontal pocket depth, improved the attachment of the gums to the teeth, and reduced gum bleeding. In fact, the more cups of green tea that were consumed, the better the results. Oil pulling. This Ayurvedic practice involves the swishing of either sesame oil or coconut oil in the mouth for 10 to 20 minutes a day. Research shows oil pulling removes toxins from the mouth, and it helps prevent cavities and oral diseases. In addition, oil pulling is just as effective as a germicidal mouthwash at eliminating bad breath, a common side effect of receding gums and gum disease. To reduce the inflammation in the gums, gently massage the gums with a mixture of coconut oil and pink Himalayan salt. Let it sit for a couple of minutes and then rinse your mouth with fresh water. Together, they have powerful antimicrobial and anti-inflammatory properties, and they help to relieve the symptoms when you have gums that are receding. Vitamin C. Having a deficiency in this essential nutrient is known to cause inflamed and bleeding gums. By boosting your intake of vitamin C-rich foods, including oranges, kale, red peppers, broccoli, and Brussels sprouts, it can help to reduce the inflammation and the bleeding that's associated with the receding gums. Researchers in India have studied aloe vera's efficacy in oral health. In the study, they used aloe vera-based toothpaste, mouthwash, gels, topicals, sprays, juice, and supplements. The findings indicate that applying an aloe vera gel to inflamed gums and pockets results in improvements of periodontal conditions. Taking 100 milligrams per day, in addition to rubbing the gel on the gums, can speed the healing also. Septolin. This Ayurvedic medicine is known to boost immunity and fight a variety of infections. It's a proprietary blend of herbs and other compounds that support a healthy immune system and reduce inflammation. A randomized, double-blind, placebo-controlled clinical trial, published in the Journal of Periodontal Implant Science, found that dietary supplementation with Septolin improves periodontal treatment outcomes. In just 3 weeks, the participants who were given the compound showed a marked improvement in their trial score. Amla, or the Indian gooseberry, is another supplement commonly prescribed in Ayurvedic practice. It's known as a rebuilder of oral health. Researchers acknowledge the amla supports healing and the development of connective tissue. It can be used as a mouth rinse or taken orally in a capsule form for long-term dental health. Anything you can do to reduce plaque and bacteria can help when fighting gum disease, but flossing's benefits are not superior to oil pulling. Using a mouthwash made from oregano oil is a great way to fight infections in the mouth. Oregano oil has strong antifungal, antibacterial, antioxidant, antiviral, and antiparasite compounds, and this can help promote healing of the inflamed gums while fighting the infection. A randomized, double-blind, placebo-controlled trial found taking 300 milligrams of omega-3 fatty acids per day for 3 months significantly reduced the gingival index, the pocket depth, and the bleeding, while improving the gum-to-tooth attachment. In addition, researchers believe it might also act to prevent chronic periodontitis in some individuals. Prevention is the best way to fight receding gums and periodontal disease. Left untreated, gum disease can cause receding gums, systemic infection, and loss of teeth. Oral bacteria are associated with endocarditis, cardiovascular disease, and certain cancers. Certain medications cause dry mouth, and this can contribute to periodontal disease. CoQ10 has been shown to help with dry mouth. Oil pulling with sesame and coconut oil is an effective treatment as it reduces plaque and improves gingivitis. A cup of green tea each day decreases the pockets and improves the attachment between the gums and the teeth. Practicing good oral hygiene daily with brushing using a soft brush and soft to moderate pressure helps to prevent plaque buildup that can lead to periodontal disease. To book a consultation or to learn about herbs, supplements, and natural treatments, check out my website.